Welcome back to the vlog. It's Saturday the 18th of April. Wow, where has the time gone? Even though it's a Saturday, it's pretty much a normal day at work for me, like probably a lot of you are experiencing in the lockdown being at home. You may be surprised in my last update that I said it's been quiet in the emergency department, and you think, hang on a minute, we've just had another declaration in the UK that we're having another 3 weeks of lockdown. Why do we need to do that if it's really quiet in the hospital? And I wanted to kind of talk a little bit about why that's the case and why I think it's a good idea that we're still in lockdown. So as I've done before, 3 parts of my day, and I'm going to choose 3 different topics as we go through to describe the situation. But anything else that's interesting that crops up throughout the day, I'll talk you through that as well. Okay, the first thing to bear in mind is the hospital is far more than just the emergency department. So all the patients that have come through the hospital that are currently on the wards and the intensive care unit have come through the emergency department over the last week or so. And so this problem has really shifted to be a problem with capacity on the wards and, more importantly, on the intensive care unit. So that's a good sign that we're not seeing as many people come in. How busy we are in the emergency department depends on 3 broad things. So the number of patients coming into the hospital, the flow of patients through the hospital, and the number of doctors, or more generally the number of healthcare professionals that are in hospital as well. So throughout the day I'm going to take one of those things and talk about them. So the first thing is the number of people coming into the hospital. Fairly obvious, right? And that's changed in a couple ways. First of all, people are really taking heed of the advice that they should be staying at home if their symptoms are manageable. That's very much a good thing. What's not so good is that that's, I think, encouraged people to not come into hospital when they have other serious illnesses. And we really want to be seeing those type of people because they often have very good treatments, things like heart attacks, strokes, other serious infections. But we are seeing a reduction in general admissions to hospital. So that's definitely a negative thing, but also is contributing to why we are more quiet than normal. Next up, the social distancing has massively helped. So this virus has a typical incubation period, so the period before you catch it until you have symptoms, around about 5 days, but that could be up to 14 days. And also people tend to come into hospital between day 5 and 9 of their illness. So we might see people that come in today that potentially had the illness, over 20 days ago. Because the social distancing has been in place for 3 weeks and the incubation period is, up to 2 weeks, and people don't present up to about a week later, that means that we've pretty much seen all the patients that have come in that were exposed before the social distancing. So now we're really seeing the effects of the emergency department from that social distancing. So great work. So people that have had the complications of the virus and ended up in hospital, so around about 19% of people, many of them have been discharged home. Sadly, many of them have died as well. And many of them are currently on the wards and currently in intensive care units. So that's why I'm saying that's where the current hold-up is, and it's less of a problem in the emergency department at the moment. The other huge thing to bear in mind is I think people are just being more sensible about how they use the emergency department given this time of crisis. So, I mean, it's widely reported that we get a lot of people present to the emergency department that shouldn't be here. So just some of the things I've had in the last year, I've had people come in because their infant's hair wasn't growing quite as quickly. Not a problem for the emergency department. I wouldn't even know where you get that sorted out. Probably no problem at all. Another one I've seen is someone that had earache after coming off a plane. I mean, that was just the pressure changes. Or we get people that come in that could easily have their symptoms sorted out by a pharmacist or a GP, or, as we said before, people that just don't need to come into hospital. So the take-home message in this part is that you guys are doing a great job in social distancing because we're seeing a reduction in numbers in the emergency department. Therefore, in time, we're going to be easing the burden on the areas that are really struggling at the moment, so the general wards and the intensive care unit, so keep it up. Okay, so I'm gonna get changed into my scrubs, start this first part of the shift, and I'll catch up with you halfway through, and we'll talk about how some of the changes in patient flow are impacting what we're doing in the emergency department in a positive way. So I'm gonna get into my scrubs, get all ready for this shift. I'm not sure which side I'm gonna be on, whether I'm gonna be seeing COVID patients or not. So whatever happens, I'm feeling motivated, and I'll give you an update halfway through. Okay, shift is going well. It is 7:30, and I forgot to mention as well, hospital started doing free food. So I just had a lovely beef curry, which might not sound that significant, but actually makes you feel really valued. And given everything that's going on, much appreciated. Also went past the main part of the hospital and you can see all the rainbow painting that everyone's been sending in, which is super nice. I might try and have a quick read of them before I go back on shift. It's picked up a little bit from the last week or so, but still nowhere near the kind of numbers we'd expect in a typical day. And that kind of goes on with what we've been talking about during this vlog. So the next thing I want to talk about is flow through the hospital and how that is improved during COVID-19 to deal with the kind of numbers. So one of the things that's happened in A&E is when patients come in, they're going directly to the specialty. So what does that mean? Well, normally when anyone comes into hospital, an A&E doctor has to see them first, and we essentially assess them and start any treatment, and then we'll refer if they need to see a specialist. You know, if it is an emergency and time critical, we'll refer them to that specialty. So things like gynecological issues are going straight to the gynae team. Things like eye problems are going straight to eye clinic, and loads of other specialties too. And this is good for two reasons. For a start, it stops people getting swamped in the emergency department here, so a bunch of us can concentrate on the COVID patients, but also stops loads of people coming into the waiting room and cohorting together and potentially infecting people. So that's two really positive things coming out of that. And in a way, a patient probably gets a better experience as well, because they're going straight to the experts, you know, kind of sidestepping us in the middle, which is not great for the specialty, because they'll see a lot of things that probably aren't that appropriate to be seen by a doctor of their kind of expertise. They could probably be okay just seeing someone like myself, more of a generalist, but it's helping out in this current climate. One of the other big changes, what I spoke about before, is us A&E doctors are allowed to do a lot of the clerking for the ward team. So usually when we refer to the medical team, so the doctors on the ward, so if a patient needs to stay into hospital, medical team would come see them and do a full clerking. So re-go over the history, order any extra tests, and do the drug chart as well. So to ease the medical team, us A&E doctors have being allowed to produce those kind of forms and clerk patients for the ward. So that's helping to reduce the burden on the ward team. Probably the biggest thing that people don't appreciate is that often in A&E, if the wards are extremely busy, that can actually backlog all the way down to A&E. So if we've got a patient that needs a bed and we're finished in A&E doing our clerking and assessment and initial management, if there's no bed available, they'll be stuck in A&E, and that can really back things up and really clog up the system. So, you know, we're working as hard as we can, but actually there's not enough beds in the hospital. So one of the huge useful things that have been done is in the weeks coming up to this, loads of the wards have been cleared, as in patients have been discharged to community hospitals, or they've got care in place at home, so that the wards are free for us to admit people with COVID-19. That's had a massive impact. So far, every single patient we have with COVID-19, there's a bed ready for them, so we can do all the investigations, all the initial management, and we know there's a ward team ready to accept them. And as I said, we can do all the paperwork as well, so it speeds up the whole process. So that flow through the hospital is having a huge impact, and you know, we're being a lot more efficient in A&E. Patients are having a better experience, and the knock-on effect is we're being less busy in A&E because everything is just so streamlined in that process. So that's a bit of a summary of things that have changed in the hospital to allow us to work well in the emergency department. So I'm going to crack on with this shift. I'll have a quick chat at the end about the last point, about the number of doctors that are available at the moment, how that's helping our situation on the ground. But shall we have a quick look at all those nice cards and drawings that have been sent in from the public? Let's have a quick look. Keep smiling. Thank you for helping us with COVID-19. And we hope everyone gets well soon, don't we all? Keep smiling. Thank you for everything you do. Keep smiling. Seems to be a common theme, this one. We think you are all heroes. Sure. Thank you, NHS heroes. How sweet. Keep smiling. Thank you for everything you do. Have hope, love, and strength. That's me. Be a rainbow in someone else's cloud. Stay home, stay safe. Then you'll help save the NHS. Yes, I like that one. To the world, you may be one person, but to one person, you may be the world. Aww. So end of another shift. It is just after 11 o'clock and this is where I started filming earlier. So nice little full circle to end things here. I was on the non-COVID side, so I saw lots of general medical and general surgical problems, so things like chest pain and abdominal pain. Generally speaking, they all came into hospital when they should. Some of the people with chest pain had waited a few days. That's not a good sign, particularly if there's a problem with the heart. We often have this phrase, time is myocardium, basically meaning if it is a heart attack and part of the heart is dying, then the longer you wait, the worse the damage is going to be. You can often get overwhelmed with everything that's going on from a public health point of view, but ultimately as a doctor, you're treating the patient that's in front of you. Although the patients I saw were clearly unwell, we had really good outcomes, so we did swift investigations, swift diagnosis, and were able to treat them quickly, which is all you can ask for as a doctor, which you can't always say is true when things are super busy. So normally at this time of year, we would expect the emergency department to be busier. And this comes back to what we're talking about throughout the whole of the day today. So the last thing I wanted to mention is how we're changing the staffing, so the amount of doctors available to deal with this crisis, and that is having a huge difference. And we're doing that in two ways. The first way is that we're increasing the kind of rotas for the people that are working at the moment. So the consultants are having some of their administration time, so times they'd normally be doing desk work, they're being drafted in, doing more clinical time, so more time with the patients and more time overseeing us juniors. So that's really good because the consultants have so much experience, and us juniors as well, they're actually increasing our rotas at the moment, which a lot of people aren't happy with, but again, it's kind of your duty, isn't it, to get stuck in. The last thing as well, which kind of applies to me, we're getting lots of redeployment. So normally I work as a teaching doctor half the time, so I'm getting redeployed in that time, so working that time with patients rather than with students. The students aren't here anyway. So by increasing the amount we're working and by having doctors redeployed to areas means we have more doctors available. So that's why days like this are slightly easier than they'd normally be at this time of year. The one negative effect of this is we have loads of doctors off sick at the moment. I know in some departments it's up to about 50% of doctors are currently at home isolating with symptoms, which is to be expected. You know, we've talked about this on the channel a few times. You're more likely to be exposed in a healthcare setting despite all the PPE. This virus is very contagious, and when you're around it with people every day with the virus, then unfortunately, despite all our expertise in hand washing and all the PPE, we are going to get exposed somewhat. So I hope throughout this vlog it's giving you a bit of an insight into why things might be quieter in the emergency department at the moment, but why that's a good sign, and all the things that are being done to try and support things if they do start increasing, because as soon as the lockdown starts easing off, you know, we are going to see more patients as well. So all those things we've put in place will again be put to the test, and you know, we'll be ready to do the best we can. Okay everyone, so I'm gonna head home. I'm back on shift tomorrow. I'll bring you along with me as well. As always, thank you so much for all the support. I hope you're all well. I hope you're all taking care of yourselves and taking care of people around you at this, you know, this challenging time. A few more weeks of lockdown in the UK, and I'm hoping, I'm sure you all are, that we are going to get some kind of relaxation of things. And you know, maybe it's going to be a long time before we're back to normality, but I think many of us just really want to see our loved ones and just have a little bit more freedom, don't we? But in the meantime, we just got to have hope, crack on, take every day as it comes. That's what I'll be doing, and I'll keep you updated with things from the ground. See you then.